evening and welcome to The Point. And this evening we have our wonderful resident GP, Dr. Laura Richardson, who's going to tell us how to make the best of our GP appointments. Laura.
Hello Richard, and hello viewers. Now I hope I'm not going to end up being the worst enemy of Revelation TV viewers by this particular topic. It is very dear to my heart because I am a practicing GP. I work in the NHS in the UK, and Richard, of course, you were a practicing GP working in the UK in the NHS. And really my desire is to offer you tips on how to make the best of your GP appointment. And that's what today's going to be about. Now listen, don't shoot the messenger, please.
Right.
So this is what this is about. And really, we've all been patients. I've been a patient. I've had to go and see my GP for things. And we know how difficult it is, or seemingly difficult it is, to get an appointment to see a doctor, a GP. Now, what I would like to say is that we are here to help you. And it might seem pat, it might seem cliche, but GPs are actually the bedrock of the NHS, because by the time a patient is referred to a consultant in the hospital, the GP's done most of the work, haven't they? We've excluded this, that and the other, and when we realise that this is out of our capabilities, this person needs to see a specialist, which is what the hospital doctor is. But we GPs, GP stands for general practitioner. We're general practitioners, so we have a lot of knowledge about the way the body works. We have a lot of knowledge about the way a disease affects a patient's life. So it's not just knowing about what the problem is, but it's also knowing how it affects you from day to day. So the first thing to say is, before booking that appointment to see your GP, ask yourself, is the GP the right person to deal with the problem? And what I mean by that is, if you have, for instance, constipation or sore throat or diarrhea or conjunctivitis, your pharmacist can actually deal with those problems without having to see the doctor. And it's only if they haven't resolved after 3 or 4 days that you'd actually need to book an appointment with a GP. In your time when you were practicing, was that advice given to see the pharmacist?
Yes, certainly.
And I would certainly encourage that. I mean, the pharmacists are very good at helping you to deal with, self-limiting problems, as I said, like chronic, like constipation, diarrhea, even sore throats and coughs and colds. In the initial stages, you may not necessarily need an appointment with your GP. But having done that, having tried all the self-home remedies, you've tried the treatment for the piles or the constipation or the conjunctivitis or what have you, and you find that your systems, you've spoken to the pharmacist, they've perhaps helped you with home self-medication over the counter, or you've tried some home remedies. And remember, I'm very much for home remedies as well. So things like constipation, syrup of figs, for instance, very, very good for that. Just a high fibre, lots of fluids. Diarrhea, you can make your own homemade oral rehydrant salt with salts and sugars and a little bit of juice or something there. You don't have to go and buy a lot of stuff from the pharmacy. You can actually make your home remedies at home yourself to help you deal with the problem. But having said that, pharmacists are the first line for certain conditions. Having ascertained that you do need to see your GP, there are lots of ways to book an appointment these days. Some surgeries offer an online booking service, so you can bypass the receptionists, who everybody thinks are dragons for some reason. I have to say, so appreciate the job the receptionists do. We couldn't do this without them. And a lot of people see them as a barrier between the patient and the GP, but they take so much flag. I mean, our receptionists, sometimes patients will cause them to be so abusive on the phone because they can't get an appointment, they can't get this, they can't get that, and they would be reduced to tears. So I just implore you to be kind to the receptionists, but do bear in mind that you can now, a lot of surgeries are offering online booking, so you actually go onto the online site of your doctor's surgery and actually book an appointment directly yourself without having to get through the receptionists to book the appointment. Now, there's a first image that helps, Richard. Now, you mentioned that when you were practicing, you only had 5 minutes with appointments. You only had 5-minute slots. I tell you, I don't know what you can do with 5 minutes these days. Perhaps a repeat prescription. If a patient came in and said, "Hi doctor, I've been on this prescription for 10 years, you check me every 3 months, so I'm up to date with all that. I've had the blood test done to make sure the medication isn't off from me. All I need is a repeat prescription." You can probably do that in 5 minutes, but I don't think there's much else that you can do in 5 minutes. And actually a survey was done of male and female doctors, and this is what it shows on the first slide, that it takes, most conditions will take more than 10 minutes to actually deal with. So the amount of time that you spend, a doctor spends with a patient, is definitely more than 10 minutes. So even with the 10 minutes, back in your day it was 5 minutes, Richard, now it's 10 minutes. Even with the 10 minutes, it is still very, very difficult to deal with most problems in 10 minutes. There are some problems that we can deal with between 7.5 to 10 minutes, and I have actually clicked my timer just to make sure I knew what I was talking about. There are certain things like simple conditions, simple infections, urinary tract infection, so long as you do come prepared with the urine sample, because some patients will come in and say, "I think I've got a UTI," and you'll say, "Okay, great, where's your urine sample?" "Oh, I haven't done one yet." And so they have to then go out and do the sample, which adds more time to the consultation. And so be prepared. If you're going to see a doctor, if you think you've got a sore throat, a chest infection, a urine sample, be prepared to be examined. So, you know, if you've got a chest infection, be prepared that the doctor would want to listen to your chest. So don't go all wrapped up and whatever. Make sure that the doctor can gain access to your chest. Wear probably a blouse or a jumper rather than a dress, you know, to make sure that there's easy access. And, you know, if you've got a urinary tract infection, you suspect you have an infection, when you get to the surgery, ask the receptionist for a pot, so that while you're waiting to see the doctor, you can just slip into the loo, do a sample, so that when the doctor calls you in, you say, I think I have a UTI, and the doctor says, "Where's your sample?" You said, "And here's one I prepared earlier, doctor." And the doctor will bless you forever for doing that, because really I have actually done a survey in my surgery of the added amount of minutes it takes if a patient who has a urinary tract infection doesn't come with a urine sample. It adds at least an extra 5 minutes to the appointment, and that is precious time. So do come prepared. Other simple things that you can deal with in 10 minutes, Richard: simple skin rashes and scalp rashes, itchy scalps, sore throats, you know, runny nose, sinus infections, eye infections. You can probably all deal with those in 10 minutes. But one thing that a lot of doctors' surgeries are now offering you are the ability to book a double appointment. And I would strongly say to you that if you think about the list I've already mentioned, urinary tract infections, sore throats, simple problems, if you know that your condition, or if you have a list of conditions, do not think that it's possible for the doctor to deal with them in the 10 minutes allocated time. And my advice from being a GP for over 20 years is this: if you have more than one important condition, preempt the fact that the doctor's not going to be able to deal with 2 major conditions in a 10-minute slot, and either ask for a double appointment or book 2 separate appointments in advance. So going to the doctor, they will love you forever. They will bless you for this. If you said to them, "Doctor, I've got 2 problems. One of them is I think I've got cancer. The other one is I've had this bowel condition for a long time. It's not getting better. I know that it's not possible to deal with both problems sufficiently, accurately, safely in a 10-minute consultation. So I'd like to talk about the cancer problem I have today, and I've also booked an appointment next week to see you to talk about the other problem." Now, a lot of people will say, "Yeah, but I'm working. You know, I can't afford to be taking time off to see the doctor." Again, a lot of doctors' surgeries offer commuter clinics, and I do commuter clinics. I'm up in the surgery Tuesdays at least twice a month at 7:20 in the morning.
Wow.
Yeah. Yeah, see those bags under my eyes, Richard? It's my patients that do that to me. So a lot of doctors' surgeries offer commuter clinics. And again, as I said, you can book a double appointment or you can book a series of separate appointments. Because if it's a complex problem, it will take more than a 10-minute slot to sort it out. And as GPs, we have to juggle the fact that we're seeing you, but we've also got a list of 20 other people to see. And if we give you half an hour that you need need for that one major problem. The other's going to be waiting longer to be seen. They've also got things they need to do. They've planned they're going to come and see the doctor, and then they're going to the bank manager, or they go to see the school teacher, whatever. So everybody's got a life and everybody's got a life. So we have to be considerate about everybody, not just you. We've got to think about you while you're there, but we've got to think about the effect of overrunning on the other patients who have a life, who have things that they need to do as well. So for your sake, and because doctors are human beings, we do make mistakes when we're rushed. Who doesn't? Yeah. And so if we go to the next slide, which is a really funny one, but this happens to me all the time, and I could be a millionaire for the number of thoughts I've had in my head about knocking a patient's head on the wall for bringing in a list like this and say, right, okay, here's my list, doctor. And you think, we're going to do this all in 10 minutes? And what I would say to you, first of all, it is good to write a list because, you've taken time out to come and see a doctor. Your time is valuable. So what I would say to you is make sure you do write a list, but prioritize your list so that you're putting the most important things at the top of the list. And when you will inevitably, as we will do, run out of time, the doctor will always say, let's have a look at that list. Okay, why don't you book a double appointment for in a couple of weeks' time so that we can deal with the other problems. So do write a list, but don't be unrealistic and expect a doctor to deal with all those problems in 10 minutes. And I do know some patients who will come with a list and they'll say, well, I've waited 20 minutes, so now you're going to give me the time I need. And I say to them, if you had to wait an hour for your plane to take off, it doesn't give you the right to have to be upgraded from economy to business class just because you had to wait an hour. Now, that's an analogy I would use. I know you've waited, but we're still allocated 10 minutes. And the reason why you've waited 20 minutes is because this patient came in what they thought was just a sore throat. And by the time I'd taken the time to ask them the right questions, do you smoke? How long have you had it for? Are you coughing up blood? I suddenly realized this is not just a sore throat. This could be cancer. And I've actually had to up what I'm doing for them and refer them and do this and that. And so the process can take longer than anticipated because the problem that the patient thought was a simple problem is actually not a simple problem at all. So the moral of the story is make lists, be prepared that all the problems on your list will not be able to be dealt with. So do make sure that you go with the most important problems first. Because Richard, you and I know about the doorknob, don't you?
Let's talk briefly about the doorknob thing.
Let's talk about the doorknob. Do you want to talk about the doorknob?
Just my only contribution for the whole programme, but yes, the doorknob. I think we're talking about the same thing, is that in the 10-minute consultation, you would very often talk about somebody's skin rash, and just as they're about to go, they say, and by the way, I've lost 2 stone in the last 3 weeks, or 2 stone in the last 3 months, actually, probably more likely, and you suddenly realise that the skin rash was, I don't know what it was all about, but actually we need to really concentrate on the fact that they've lost 2 stone in the last 3 months, and they've either got very bad diabetes or cancer or something equally serious. I presume we're talking about the same thing.
Absolutely.
Over to you.
The doorknob. Oh, I hate that. And, it's so stressful. I mean, if you talk about stress, that's a decision where I have to make. And it's like, do I give them the time they need? Because this could be cancer, or this could be something serious. Or do I say, well, listen, you wasted 10 minutes talking about your little rash, and now as you're about to leave, whatever. And what I do tend to do is I actually do a little bit of a compromise, and I'll say to them, now I would actually tell them off, and I'll say, actually, that's really what you should have talked about first, and the rash could have waited. But being that I am concerned that you have this problem, which could be serious, I would like you to come back and see the duty doctor tomorrow. So we have a duty doctor who is not really supposed to be dealing with suspected cancers, but in view of the fact that this could be something quite life-threatening, very quickly, I would say come back and see the duty doctor. But if I assess it in the doorknob, I think, no, I'll say, okay, no, this can wait. come back and see me, and I would actually give them a date and a time and let them know that I'm available at such and such time. So go to the receptionist and I'll write a note for the receptionist to say, I want to see this patient, squeeze them in if you have to, put them at the end of the surgery if you have to, I want to see them in so-and-so time. But to avoid that, make sure that you don't be a doorknob patient, and always have a list and start with the most important things. Because sometimes the things are embarrassing.
Yes.
The doorknob is because they've got the rash, but really what they're worried about is a discharge or something like that. And they plucked up the courage to talk about the rash. They're all right. This doctor's nice. This doctor's listening. This doctor's attentive. They've got a good bedside manner. Maybe I'll just shove that in their face now, just about to leave and see what they come up with it, you know. But this is 20 years of experience, and you've got to laugh, Richard, sometimes.
You have to.
You do.
Just one more very practical thing is that I used to run a diabetic clinic. I looked after 300 diabetics in the practice of 20,000 patients. And we actually asked everyone to go and have a blood test before they came to see me. And we actually wrote there, please go and have a blood test a week before you come and see me, because we wanted to know what the HbA1c, that's a glycosylated hemoglobin, was, and all the rest when they actually saw me. And about 40% of the patients would go and have their blood test the morning, about 10 minutes before they saw me. They saw the phlebotomist and then they literally drove half a mile to see me. Well, of course, I haven't got the result of the blood test. So it's quite common nowadays with hypertension and asthma and diabetes that the doctor requires you to have a blood test or a urine test or some sort of test before you see the doctor. Please go a week before to give the blood test results or the X-ray results or whatever test it is, those results to actually arrive at the doctor when you see them. Small point, but actually really important.
Do you know, that is such an important point, and thank you for mentioning that. It's really key, actually, because that's I could be frustrated at a head banging session. I haven't got the results. Why are you here? And what we do say to patients now, because in the NHS, there's ethos about the patients are clients, the patients are users, service users. They're not patients anymore. So it's kind of altered the way we look at patients. And I think in some ways it's good, but I think it can go overboard where we actually lie just to get the patient satisfaction. And this has happened so many times where you go for an X-ray or something. I'll say, oh, it'll be there tomorrow at your doctor's surgery. And we know that's no way it'll be there tomorrow, because the X-ray report has to be read by the consultant radiographer. It's got to be dictated. His secretary or her secretary's got to type it out, and then the secretary's got to email it to us or whatever. That's not going to happen in 24 hours, whatever. You know, if it was an urgent situation, it'll be done. You know, they would phone us directly or fax us. But for most bog standard X-rays or scans, I would say to the patient, please, please, please. I know what they're going to tell you when you go to X-ray, because they're there to please you and they want good reports and they want, oh wow, and that's what patients will say. Wow, this patient, they went to the X-ray department and they said the results will be back tomorrow. Aren't they wonderful? No, that's unrealistic. So I would say to the patients, a week after you've had your test, phone the surgery first, make sure the results are there, and then book that follow-up appointment. Because it's frustrating, it's a waste of an appointment for them, and it's a waste of time. That appointment could have been used by somebody else. So absolutely, preempt, always think ahead. And I think one of the good things about doing this is actually helping patients to know how the system works. Because it's a bit like when you're going on a plane, you're there, you can do things, you can leave your boarding pass till you get there, or you can print it out ahead at home, and it makes things quicker for you when you get there. So knowing the system, knowing how things work, actually helps you to get the best out of the system. And ultimately, that's why we went to medical school for. We didn't go to earn big bucks, because quite honestly, it ain't big bucks as a GP at all. It ain't big bucks. We're not allowed to do private practice. A lot of hospital consultants do private practice, so they've got NHS work, and they see the same patients privately. I can't see my NHS patients privately. We're not allowed to do that. So the buck earning capacity is really quite severely curtailed. We're not that high earning. You don't go into medicine to earn big bucks. You go into medicine because you care for people and you believe you've got the skills that it takes to use to help people to get better, to stay well. That's why most people go into medicine. So it's not about earning big bucks. We want to help you, we want to get the best out of you. It's very disheartening, Richard, when you miss a diagnosis. I know when I've had a situation where I thought, oh, I got that wrong. That was not what I thought. But there are lots more situations when it's like, yes! And they'll come and say, you saved my life, doctor.
Yeah.
There was this patient who was in America. I said, Mr. So-and-so, get yourself back to the UK now. You got cancer and you need to go into surgery ASAP. And he came in to see me about 2-3 months after his operation with his wife. I said, thank you for bullying my husband to get back to the UK. Because he was gone. He said, oh, I'm off to, wherever he went, America it was. I'm on holiday. I'm not going to come back and do whatever. I said, you get yourself back here now.
Right.
You need, you need to be treated. And that's what we're there for. We're there to help you with it, but we want you to help us to help you as well. So make a list. Be prepared to have a double appointment. Be prepared for the doctor to say, we can't deal with that. Don't go off and write letters and complain, because that's what patients can do. They can get a little bit vindictive. And because they don't get their way, they will go and cook up a few stories. Oh, and she was rude, and she was this, and she was that, just because they didn't get their way. And I'm hoping that the viewers who are watching this are Christ-like and would not be vindictive just because you didn't get your way, but they would consider the fact that the doctor has to deal with lots of different things at the same time, and as much as they would love to give you all that time you need at that particular time, it's not possible because there are other patients to be seen and the other thing, the things to do. We're not just seeing patients, because we're also looking at results, consultants' letters. We are referring letters ourselves. We're picking up phones from social workers, from the palliative care team, from hospital doctors who want more information, from the community health team. We're interacting with different people behind the scenes which you may not be aware of at all. So do you want to add anything to that, Richard, as we're...
Well, the one thing came to my mind is that it's rather extraordinary, but one thing that you can't learn at medical school, and I'll be interested, I haven't actually discussed this with Laura before the programme, but I actually used to pray, I became a Christian in 1974, but I used to pray at the beginning of every day that God would actually help me to do, to make the right diagnosis. And whether the GP is a Christian or not, we all get these sort of funny intuitions, shall we call it. It may be God answering prayer, I actually don't know. But I'll give you an example, and it's one that actually I remember very well, is that a little boy, age 4, who was actually, he's a little boy of friends of ours. I didn't know them very well, but they were friends. And this little boy came to see me with a sore throat. So I looked in his throat, and it did look a bit sore, but he looked very ill, and he looked sort of iller than he ought to look. Now, I don't know why, but I did a blood sugar, which is very unusual when you're presented with a child with a sore throat. But anyway, I did a blood sugar, and his blood sugar was sky high, and he had sudden onset type 1 diabetes, and he was very, very ill. Now, how on earth, I actually think probably God prompted me, I don't know. I'm not claiming any special spiritual connections or anything, but either it was intuition, that he hadn't got diabetes all over his head, but normally if a child sees a doctor with a sore throat, you don't immediately do a blood sugar. But anyway, I did do a blood sugar, and probably it was just as well I did, actually, because he was very seriously ill. So anyway, it's a very strange thing, but doctors sort of have an intuition, sort of a feeling about patients, but you can't really learn except by experience. Would you agree with that?
I totally agree with you, Richard. And I am in awe of the way that I entered into the field of medicine. God told me when I was 14 that I was going to be a doctor.
Oh, right.
And I know that I was called into this profession. It's not just, your parents want you to be a doctor because whatever. Yes, and yes, they did. I come from a very educated African family where everybody had to be a professional. There's no question about it, I mean, I'm actually very creative. I'm seriously creative. And in school, I was in singing and dancing and acting. I still am. I'm a very creative person. But science, you had to be a professional, and there was no two questions about it. But it was God, because God prompts the parents to lead a child in the way they should go. And God told me when I was 14, I wasn't even a Christian. I was a churchgoer when I was 14, but I wasn't born again.
No.
But God told me I was going to be a doctor. And it took another 15 years before the realization happened. And the twists and the turns and the ins and the outs in the Word of God almost seeming not to come to pass, because not only did I fail exams, I was almost kicked out of medical school, but you know, all through that, God showed me his faithfulness, even to the point where I refused to study on Sunday, even before my exams. I kept the Sabbath. I wouldn't study on Sunday. And also the things, I lost jobs because I wouldn't take part in abortion, in the procedure, and all the rest of it, as a consultant who tried to get me struck off the GMC for that, and all sorts of things. And I absolutely hear what you're saying, that there is an instinct as a praying, Bible-reading, Spirit-filled Christian. There is something, in addition to the medical experience of 20-odd years, there is something that you're absolutely right. And I've seen it so many times. And, you know, I could bring cards in and flowers and chocolates for patients who've said, thank you for saving my life, but why did you do that test? Because that's not what I came in for, or whatever like that. And, you know, that is the beauty of God. And I'm not saying that people who are not Christians don't have that instinct, because this is an experience. And, you know, younger doctors, as they come in, we've got some young doctors working in our surgery at the moment. And although I don't look like an experienced doctor because of the way I physically don't look as old as I am, they realise I'm experienced, because they'll come in and they'll say,
you're young, Laura.
I am young, but I mean, you know, I am... Yeah, my mum says never tell your age on screen, so I'm going to, in respect of my mum, I won't. But I am old. I've been a doctor for over 20 years, so that shows you I must be at least 40-something. But you know, that instinct you said, it's the Holy Spirit. He says, you know, the quiet voice, walk in this way. Yeah. So I really feel we could do a series on this, but hopefully that sort of enlightened you a bit, because we want to help you.
Well, that's been really, really helpful, Lord bless you. And thank you so much. It's really helpful to have a practicing GP, unlike me. I'm just an old retired GP. But anyway, really helpful to have a practicing Laura. Thank you so much for educating us and reminding us all the things we need to do before we go and see our GP. And we hope you're enjoying these programs. We'd love to hear from you. info@revelationtv.com. That's the email address for all programs. Just write to info@revelationtv.com. And particularly for the medical programs, which tend to be produced by Laura, could you give us some ideas of any particular areas that you would like Laura to cover? We're here every Monday, 8:30, and they're repeated throughout the week, but every Monday, 8:30. Birgit's in Australia at the moment. No, she's not. She's in New Zealand. She'll be joining us. But the three of us, we're always here. And Laura, thank you so much for joining us. Thank you for all your expertise.
Don't shoot the messenger.
We'll see you again 8:30 next Monday. God bless you and goodbye.